How many patients were included in your study, and can you summarize how these patients were treated?
We have enrolled 520 patients, 260 patients in each arm. The main characteristic for the patient is PT1B, PT1C, PN0 cancer, and the majority of our patients are luminal A cancer. The patient was randomized one by one, and we have only low percentage of patients with positive lymph nodes in the axilla, because axilla was not an inclusion criteria for our study.
The study was set up to examine whether the two methods give similar results. How was equivalence defined?
At the moment, we obtain similar results in terms of local relapses and overall survival, and also distant metastasis. The technique are very easy and simple. The standard technique is a two tangential field, and the new technique is EMRT step and shoot in a small volume of the index quadrant.
What were the outcomes with respect to your primary endpoint, which was ellipsoid breast tumor recurrence?
The outcomes was the primary endpoint at the moment, because obviously we have only 5 years of follow-up, was obtained because we have the same local recurrence, and so we are happy about it, because obviously in 10 years ago when we started to organize the study, it was very big doubts about the possibility to give partial breast irradiation and obtain the same result that with standard technique.
And how did the techniques compare to the other endpoints, overall survival and toxicity?
Also, overall survival and toxicity were excellent. Overall survival is too early to define, obviously, the overall survival. Maybe we need another 15 years for us to say that overall survival is the same, but the outcomes is excellent, because we really obtain an excellent cosmetic result in patients treated with MRT. Sometimes it's impossible to recognize the breast that was operated and irradiated. It's a very amazing result at the moment, because now we have only 2 cases of early late acute toxicity, but in the other groups, so in the whole breast radiotherapy group. So to be honest, we are very happy about this type of result.
And are the results convincing enough to recommend ABPI for all women with small breast tumors who are treated with radiotherapy? And is this technique available everywhere?
Yes, my suggestion is that now we have to wait maybe another 1 or 2 years, because the big American trial B39 is near to be published. But I believe that partial breast irradiation is the future for this type of patient, and IMRT now is available everywhere, and our step and shoot technique is very easy, and you can obtain without any problem, and so is another facilities that all center can have at the moment.
Can you tell us something about study limitations you quoted?
Study limitation is now the 3. The main limitation is the follow-up. The second limitation could be the relatively small number of patients, because we randomize 520 patients, and so maybe it's not a big trial B39 is around 5 or 4,000 patients, and so this is important. And the other one is at the moment the small number of local recurrences. And so for statistics, maybe this is a bias. So we have to wait maybe another at least 5 years to start to understand if the result is confirmed. And so we for the patient, I hope that the result will be confirmed in the next year.